That's a big boy right here.
We're recording here.
There you are.
Yeah.
Sure.
No, not yet.
Okay. We'll cut it down.
It's okay. This is the life of Allie. Talking to the dogs. All right, so we're just waiting for Amanda to tune in. Just making sure my volume's up. Hopefully this works here. Okay, here we go.
Hi.
Again. So it's recording, but I just have to explain this because it's kind of comical. We had like all sorts of technology issues this morning when we first spoke.
Right.
Zoom wasn't working on your computer, and then the whole interview just didn't save to mine. So we're doing again because I think it's really important to get this information out to mamas in the community. And so thanks for taking an extra half hour out of your evening.
Yeah, definitely. Yeah, I'm glad that we're going to do this again. Thanks for taking a half hour of your evening as well. So,
of course. So let's go ahead and get started. Tell us a little bit about yourself and your practice.
Yeah, so again, my name is Amanda Gotschall. I'm the owner of New Physical Therapy. And I got into this work, well, actually it started off, I wanted to be a teacher back in college, and halfway through I got a job at a PT clinic, and I immediately fell in love with the profession. I saw the immediate results that it provided patients and the effective treatments. And so after that, I made a career change halfway through college and decided to go into PT, and I haven't looked back since. I've loved it ever since. And then I got in a bad bike accident, and then I really saw the effects of physical therapy and how helpful it can be. And I had that personal experience, so it made me appreciate the profession even more, going through that myself.
Yeah. How long did it take you to heal from your accident?
Well, it was like an ongoing, honestly, it took a few years to kind of get everything taken care of, but yeah, I feel great now.
Good, good, good.
Yeah.
And then, so you
Yeah.
specialize in pelvic health and pregnancy and postpartum. So how did you
Yeah.
get involved in that? What sparked your
Yeah,
interest?
that's a good question. Yeah. So at the time I was working at a clinic and we focused on the spine and chronic pain and other injuries. And there was a pelvic PT at the clinic that I worked at, and she, first I was like, what's this about? I was really interested. And then after kind of learning a little bit more about it, I realized that there's over 30 muscles that attach inside of the pelvis, or not inside the pelvis, just around the pelvis. And it made me realize like how important that pelvic floor really is. And
Mhm.
after that, I started kind of looking at delving deeper with some of my patients, and I realized that a lot of their injuries were coming from around childbirth, like women that, maybe they had a baby 30 years ago, 50, 60, 70, 80 years old, and they would tell me they had hip pain, back pain, maybe some history of prolapse, which is where your organs kind of fall down. And it all started around childbirth. So it got me really interested in really preventing long-term problems from having babies, and really got really passionate about helping women starting at pregnancy.
Awesome. And you have children
Yeah.
yourself, correct?
Yes, I have children. I have two children. I have Madison, she's 2.5, and I have Grayson, he's 1. And yeah, it helped me just get even more passionate about the profession because I was able to, again, to like experience that myself and go through the birth process. And they were close in age, so I had that experience. And it just really made me realize how long it really takes the body to heal
Mhm.
from the pregnancies, and how you have to be really patient with your body when you're going
Mhm.
through that process, and just kind of listening to what your body needs. So I thought that was great that I had to go through that. It's made me a better PT since. So
Yeah, absolutely.
yeah,
It's really great just having like your own experience. That way you can kind of pass that along to other people, whether it's your patient or your client or even a friend. Um,
totally.
so that's awesome. Um, and when you say pelvic floor, can you explain what that means to people who don't
Yeah.
understand?
Yeah. So the pelvic floor, that's a good question, is muscles that are attaching to your pelvis, and they really support. So they have 3 different purposes. The first is to really support your organs inside of your pelvis. And that includes, I wish I had my model here. I'm kind of using my hand, which I have marker now from my daughter. So interesting. That could be the pelvis. Anyway, this is the pelvis. And inside of that lies the bladder, the uterus, and the rectum. And then, so really giving support to those organs. And then also those muscles help support to prevent leakage, so incontinence. And then they also help so you can have a pleasurable time with intercourse. So it can be, if it's painful, that causes, painful intercourse. So they're really important muscles that wrap from the pubic bone back to the tailbone and kind of just give that whole area support. And then inside, I can pull it up. Maybe we can share a picture, but inside there's also muscles that are hip muscles. So that's where the hip pain comes in, that it can be from a hip muscle coming from inside of the pelvic floor.
Interesting.
Yeah.
Cool.
Yeah.
Thank you for explaining
I
that.
hope that helps. I know it's a little, I'm a very visual person, so not having my pelvis in front of me is a little hard, but anyway, we can
That's
share a
okay.
picture later if it helps.
Cool. Yeah, sounds good. Um, so tell us a little bit about your services. What do you offer?
Yeah. So I do this. The first visit is a really thorough PT assessment, and in that visit, we go over everything from like treating the entire body. So typically, I'm seeing right pelvic floor, and then with that, I'm looking at, is it coming something from the foot, or the neck, or somewhere else in the body, like what's really causing the pelvic floor issue. And then so we're looking at the whole body, and I usually like to do treatment on that first visit, and then also give a really simplified home exercise program that, only a couple exercises. I find that if I give more than that, it just makes it hard to do. And so also I'm trained in trigger point joint needling and biofeedback, which we can talk a little bit about more. And then I also like to do running assessments, especially with postpartum women. And then I give really individualized program for pregnancy at different stages of pregnancy, and then also postpartum. And then I have extra certification for the pregnancy postpartum. So it's really helped me. I feel like I have a lot of knowledge around that area.
Yeah.
Yeah.
So what's biofeedback and dry needling?
Yeah, good question. So biofeedback is a technique where I put these sensors, they're like little stickers, so they're not painful, around the perineum. So that's, again, that area between the vaginal and rectal opening. And I put sensors there. And then I turn on the machine and it gives us feedback, basically, biofeedback, on what the muscle's doing. So if it's firing, it'll go up. If it's not firing, it'll go down. And so that really helps patients that are having a hard time understanding that area, how to really fire the muscles. Or if they're having a hard time relaxing the muscles, we can also use it to help relax the muscles as well. And then I get them doing movements, different functional movements like squats, lunges. Sometimes we do it with running, different movements to really help know what's happening. And then dry needling is a technique I use where we use tiny needles and we put it into a muscle, and it causes a twitch response in that muscle. So it helps it relax the muscle. I also use it to help facilitate or turn on a muscle that's not firing. And then I also use it, just if there is a muscle that's not necessarily painful, but it's causing the problem, that's a really good muscle to needle as well. So it's a really effective treatment. I find that people get better like 50% faster with that treatment, and it can be really helpful.
That's incredible.
So, yeah, it's awesome. Yeah.
And it's not related to acupuncture.
Correct. Yes.
Completely
So,
different.
yeah, it's a totally different. So the way I like to describe it is if you had a hammer and you gave it to, if you had a hammer and a doctor has a hammer and then a carpenter, they're the same tool by name, but they're very different purposes. So it's kind of like that. I have a lot of respect for acupuncturists and I work with them all the time. And it's just a totally different treatment approach versus doing trigger point joint needling. Yeah.
Sure.
Yeah.
And then I saw on your website that you offer in-home treatments or sessions.
Yes.
So in what situations would that be more beneficial than somebody coming to see you?
Yeah, that's a good question. So I find that when you're early postpartum, it's really hard to get out of the house from personal experience. So I offer this for those that really just want to have that more in-home personal session, and it just makes it a lot easier for them. And then for those like with the current circumstances, I also have done a lot more telehealth visits. And so I find those are also can be really beneficial for any mom, that doesn't or can't come into the office, doesn't want to or can't. So
sure.
Yeah.
And I'm sure that helps during this time, the whole virus thing, just being able to connect over Zoom or whatever it is, over the phone even, so you can continue helping mamas and your patients.
Yes, it's been awesome. Yeah.
So what does a typical appointment look like? I know you said the first visit is usually longer just to look at everything, but the following visits, what do they look like?
Yeah, so the following visits will typically, I just continue to reassess patients based on how they're responding to the treatment. So, if things are helping, I continue to do those things. If it's not, then we change it up until something really works for that person. Everybody's body is different, so I make sure we are matching where their body is at. on their recovery path and all of that. And in those visits, I like to make sure we get some manual treatment, meaning I'm doing either soft tissue work, that means like massage kind of technique, fascial work. We're doing joint work, like joint mobilization, and also trigger point joint needling if that's indicated. And yeah, I like to keep the exercise program simple. So we progress exercises, and I try to keep it people strong, getting stronger, especially after birth.
Yeah. So is pelvic floor work beneficial for everybody? I know, like, especially women during their postpartum period, I'm sure it's really beneficial then, but can anybody come see you? Is it preventative, or do people typically find you when there is something going on?
Yeah, that's a good question. So I find it to be really helpful for almost everyone. There are immense changes that happen during the pregnancy and postpartum time. And with that, I feel like really everybody would benefit from at least an evaluation, especially if they're postpartum, just to really know what is happening in their pelvic floor. And then really with the exam, if you're not having symptoms, the goal of that would be to check what the strength of the pelvic floor is like, if there's any sign of prolapse. So again, that's when the tissues are, the tissue, I don't know why I keep using that word right now. But the organs are coming down into the either the bladder, the rectum, or the uterus are coming down into the pelvis, into the vaginal opening. That can cause problems. And then just really preventing so they don't have the problems that I saw in those women that were later in life, just preventing lots of things like back pain, hip pain, and all that. If they don't have those things, other symptoms that, I would be looking at would be for diastasis recti, the pain with intercourse we could be looking at, if they're leaking or they're having pressure. And really, it's just important to get their body back.
Yeah, absolutely. And
Yeah.
during our earlier interview, Amanda was saying that women in France who have just given birth are actually, everybody gets one session, right? One pelvic floor.
They get a series. Actually, they get like a series of treatment with their which is pretty awesome, right?
That's amazing.
Some people only need one, but yeah.
So cool. I love it.
Yeah. Thanks for bringing that up again. Yeah.
Yeah.
Pretty awesome.
Just a tidbit, America is definitely different in some of our ways of doing things surrounding birth and the whole thing. So
yeah, totally.
So you work with pregnant women, and so how can you work with them throughout their pregnancy? Is that correct?
Yes. So, and my ultimate goal is to really see them during each stage or trimester of their pregnancy, because there's a lot of changes happening in the body. We can adjust their exercises and make sure that they're right for them at that time, and really make sure that they're ready for birth and that their pelvic floor is ready. I can teach patients how to bear down and really make sure the pelvic floor is opening to give them the best chance for vaginal delivery, whether they're their first time mom or having a VBAC. And the goal is just to keep them strong and prevent further injury down the line, and again, set them up for the best success during their postpartum period.
Cool. And I'm sure it's really great working with women throughout their pregnancy and then after they've had the baby, just like continuing that relationship and seeing them like grow and get stronger.
Yeah, it's really awesome. I love it. I love it. I love seeing the changes that happen, for sure. I'm sure you can appreciate that too.
Yeah, definitely. Very rewarding.
Totally.
And then how long after birth do you typically see women?
Yeah, a good question. So I typically do an internal exam around 6 weeks postpartum. So around the time after they're cleared by their OB or midwife. However, 6 weeks is a really long time not to be getting any sort of care or information. I know that now actually BCH I think those other hospitals are doing visits at around 2 weeks as well, which I think is great. But yeah, so I love to have the check-in, especially if I've been able to see them during pregnancy around, 2 weeks or so if they need it, just to answer any questions they have about their healing and give them an exercise program that they can start pretty gently around that time. And I don't do any internal assessment at the time, so that's usually not until they're healed and cleared by their midwife or OB, but we're able to do a lot of education at the time.
Cool.
So,
Awesome.
yeah.
I'm sure education is a big part. I know for
Yeah.
me personally, whenever I'm getting any sort of like therapy or whatever it is, I really like to know why
Right.
I'm doing something. And so the education piece is like super important.
Yeah, definitely.
And then going on to talk about the virus and what it's been doing to businesses across the country. How has it affected your business? And are you seeing people normally again? Obviously, you're still doing telehealth occasionally.
Yeah.
Yeah. How are you working through that?
Yeah. That's a great question. Yeah. So I have put I was closed for about a month, and then during that time, and I've been able to open, and fortunately and gratefully been able to see a full caseload now, and been able to help lots of moms and other patients that need help. So in the time though, I've developed a lot of protocols that are in place. I'm washing my hands between each patient. I'm cleaning and sanitizing the surface after each patient. I have an air purifier in the room. I wear gloves with each patient. And what else? And I do the temperature screens.
Mm-hmm.
So yeah, so I'm screening them and taking their temperature. Yeah, so I'm doing all the things. And really, I find I've been very grateful that my patients have trusted me, and knowing that I'm keeping them safe and doing the best I can to look out for their best. Oh, of course I'm wearing a mask too. I guess I didn't even include that, but yeah.
I feel like that's just
Wearing a
common
mask.
like knowledge for most people.
I know. Totally. Yeah. Yeah. I actually forgot. I don't think I said that last time. Anyway, but yeah, so I'm doing all the things, and I do feel like people feel safe coming in, because a lot of them are vulnerable, pregnant or being early postpartum with a newborn is a vulnerable time. So I appreciate their trust.
Yeah,
Yeah.
absolutely.
Yeah.
Tell us about your relationship with the insurance companies. Do you take insurance, or how do you go about that?
Yeah, so I'm out of network with insurance, and what that means is when someone comes in for an appointment, they pay up front for their visit, and then I give them a super bill to submit to insurance. And the reason why I've chosen to be out of network is because I find that I don't want to really be dictated by insurance. I find that they really limit either the amount of visits we get or the time that I get to spend with a patient. And I find, especially with pelvic floor work and especially with moms, I really need that time with them, and I need them to get the best care possible. Mm-hmm. And the way to do that is to be out of network and make sure they get that care that they deserve.
Awesome.
Yeah.
So then how can mamas set up an appointment with you? How do they get a hold of you?
Yeah, so they can email, text, or call, and that information's all on my website. I also have online scheduling that they can schedule, and that's up to date as well. And I am always happy to answer any questions about anything at all. Like, they can email me. It's probably the best way to do that, but happy to answer anything.
Awesome. And I'll definitely post your website and information along with the video on my website, on my blog page, so people can easily find you and get a hold of you. And then I don't know how to do the screen share on Zoom. I haven't had to do that yet. So as far as sharing a picture of the pelvis, I don't want to like even risk losing this video unless you know how to do it.
Yeah, I can, let's see. If you give me a second, if you work with me. Oh, sure. You can only, only the host. Oh, wait, I'm so sorry. I'm not on my computer because, yeah, I don't know. I don't
Okay.
use Zoom enough to.
No worries.
We'll just post. We can just post it on separate if you want, or
Okay, cool. Yeah, if
whatever.
you want
Yeah,
to shoot me over like a really good picture that you use to kind of teach people,
sure. Yeah,
I can post that as well. And yeah,
sounds good. Yeah, I have a pelvis model that I usually use in the clinic, so it's 3D. It really helps. So,
so cool.
yeah. So, So thank you so much, Ellie, for having me.
Yeah, of
I'm
course.
glad we were able to do this again.
Yeah, likewise.
So,
Sorry it didn't
yeah.
work the first time.
Yeah, no problem. So, and yeah, I look forward to working with you more in the future. And thanks again for
Likewise.
having
Thank
me on.
you.
And I'll send you a picture. Okay.
Awesome. Sounds good. Have a good night.
Okay. You too. Bye.
Bye.